Okay, let's continue again. So this is going to be starting part 4. So part 3 a little bit shorter than the other part, so we're part 4 right now. So we're saying vasodilator like hydralazine and minoxidil, they work on more of dilating the venous system. Hydralazine, minoxidil can be used also for male pattern baldness to try to growth hair. It's antihypertensive for diabetic patients. So if a diabetes patient with hypertension, then you want to start with like ACE inhibitor or alternatively an angiotensin receptor blocker. Somebody with hypertension and high cholesterol, hyperlipid, then you want to start with an alpha 1 antagonist. So that would be the prazosin, the osin type of drug. Antihypertensive for congestive heart failure, ACE inhibitor. Usually for congestive heart failure, ACE inhibitor is the drug of choice, or alternatively you have angiotensin receptor blocker. Remember, ACE inhibitor and angiotensin receptor blocker are teratogenic, and they are not used for pregnant women. Statin mechanism of action is by inhibiting the HMG-CoA reductase, so hydroxymethylglutaryl coenzyme A reductase. So statin can decrease the bad cholesterol, the low density lipoprotein, decrease triglyceride, and increase high density lipoprotein. So that is the good lipoprotein, the high density. Side effect of statin is the rhabdomyolysis, so like muscle lysis, myalgia, muscle pain, diarrhea, lupus-like syndrome. Also, statin is not used in pregnant women because it's pregnancy category X. So usually when patients on statin, they need to have monitoring of liver function tests because it can cause liver problem. And also creatine phosphokinase, that is a marker for muscle function. Most potent agent for HDL is actually a very high dose of niacin, which is a nicotinic acid, vitamin B3. In this case, it's about like 100-fold higher than the daily requirement in terms of nutrients. It will increase the high density of lipoprotein, but the problem with nicotinic acid is actually it can cause flushing of the skin, and also it can cause itching. Inhibition of absorption of cholesterol, so another way of trying to lowering cholesterol absorption from the diet is by using ezetimibe. Lipoprotein lipase activator can also be used, the fenofibrate and the gemfibrozil. So those are the fibrate class of drug to lower the bad cholesterol. Bile acid sequestration, cholestyramine, cholestyramine. So in this case, it will inhibit basically absorption of fatty acid or dietary type of fat. So with this drug, is actually kind of might interfere with the drug absorption. So usually you either take the drug after maybe 4 hours of taking this drug. Another thing that can happen is that this drug can interfere with the fat-soluble vitamin absorption. The fat-soluble vitamin are the DAKE, right? D-A-K-E. So instead of cake, it's DAKE, D-A-K-E. Anticoagulation, aspirin can irreversibly inhibit cyclooxygenase, and that way decrease the production of thromboxane. Thromboxane is important in platelet aggregation, and the reason aspirin works because it's irreversibly bind to the enzyme. So the platelet do not have nucleus, then it will die with the enzyme, so you need to have new platelet in order for the cyclooxygenase to work again. So that's why it's a longer duration of action. That's why aspirin works better than the other NSAID like ibuprofen or naproxen. They are not irreversible in terms of inhibition of cyclooxygenase. Clopidogrel P-degrel and T-clopidine, so those will block the ADP receptors, adenosine diphosphate receptor, so it also play a role in terms of platelet aggregation. Block phosphodiesterase, so dipyridamole, and usually they are given in combination with aspirin, so it's in a way it is a synergistic effect working on two different mechanisms. So when a patient on warfarin, they need to have monitoring of the prothrombin time and the international normalized ratio. That's a universal ratio to monitor blood coagulation. And usually you want to keep it between 2 to 3. If you're above 3, it means that you're more prone to bleeding. If you're below 2, you're more prone to clot. And warfarin have a narrow therapeutic index, so that's why close monitoring is important. Another thing is warfarin actually have a lot of drug interaction with like aspirin, with Tylenol. Warfarin mechanism action inhibit a vitamin K dependent clotting factor, and it is categorized as pregnancy X, so it's not used for pregnant women. Thrombolytic agents, so in this case these are more of the molecule that actually can break the thrombus. Okay, so thrombus is something that stay on the vessel. When the thrombus breaks away, it become emboli. Okay, embolus. So in this case thrombolytic, so it will lyse the thrombus and open up the vessel. Indication for thrombolytic: acute myocardial infarction, acute ischemic stroke. Moving on to pulmonary agents, you have drug used for asthma, usually beta-2 agonists, like albuterol would be an example. Corticosteroid would be like betamethasone, dexamethasone. Phosphodiesterase inhibitor that would be like the theophylline, so they have the phylline suffix. They are more of xanthine type of derivative. It's like related to the caffeine in coffee. Anticholinergic like the atriopium and tiotropium. Leukotriene receptor antagonists, so those are the Lucas, multi-Lucas, or the Zoliton, which is the enzyme inhibitor. So here are some of the drugs I just said. Phosphodiesterase inhibitor, theophylline. Okay, non-specific side effect of inhaled corticosteroid is that you can have thrush, and also there are different side effects of corticosteroid, where it could be causing increasing intraocular pressure. Could also cause posterior subcapsular cataract, but then other thing is that it can also increase the risk of infection, and it can long-term use can cause osteoporosis and can lead to mental disturbance, and it can also cause fluctuation in blood sugar. So there are multiple effects of long-term use of corticosteroid. Treatment of beta blocker induced bronchospasms. So you have ipratropium and tiotropium. So in this case, it can block the muscarinic type of receptor. Leukotriene antagonist, I said Lucas, Zephyr-Lucas, multi-Lucas, and drug to treat acute asthma, you have EpiPen or albuterol. So for more of a long-term treatment, is actually prophylactic kind of thing. You can use inhaled corticosteroid. Drug to treat asthma, acute asthma, is EpiPen, albuterol, I mentioned already. Aspirin triad, these are some side effects with aspirin. It can cause asthma, can cause nasal polyps and rhinitis. COPD treatment, inhaled anticholinergic like ipratropium, beta-2 agonist, the albuterol, theophylline, inhaled steroid. Allergic rhinitis, antihistamine, so you have Benadryl would be the first generation, cause sedation. The second generation would be the Claritin, Allegra. Alpha agonists, in this case, it's kind of serve more like a vasoconstrictor and help with nasal decongestion. Intranasal corticosteroid can help with that because it will inhibit the cascade that will produce the prostaglandin, thromboxane, and histamine. Cromolyn, this is a mast cell stabilizer. So antihistamine, so as you can see, you have Benadryl and loratadine, that's Claritin, fexofenadine, that's Allegra, and then you have the Zyrtec. Major side effect: Benadryl, dry mouth, eye dilation, sedation, tachycardia. So in a sense, they kind of blocking the cholinergic system, so they kind of cross-react to be an anticholinergic. Nasal congestion: phenylephrine, pseudoephedrine. Cystic fibrosis to reduce mucus, and acetylcysteine, so mucolytic, so they help to lyse the mucus or stuff. And acetylcysteine is actually also available in topical drop to help to lyse if you have filamentary type of keratitis in older patient. So mucolytic. Another thing to know about an acetylcysteine is that it is an antidote to Tylenol poisoning, to acetaminophen poisoning. Antitussive drugs, so I mentioned in terms of cough, codeine, and dextromethorphan. Dextromethorphan, it get less to the brain, so less addictive type of behavior, so it's used, it's available over the counter. Cough expectorant, acetylcysteine, mucolytic. GI sister agent, so you have the GERD. It's due to a problem with lower esophageal sphincter, or just kind of upper part of the stomach. So you can use antacid for short-term use only, quickly neutralize. Antacid is not for long-term use. Or you can use a histamine type 2 antagonist, a proton pump inhibitor, prokinetics, so help movement of the GI, bethanycol, which is a cholinergic agonist. Or you can use mucosal protectant like sucralfate, so it could coat the lining of the stomach. Sucralfate side effect is constipation, nausea. Antacid side effect for magnesium, it get diarrhea. For aluminum and calcium is constipation. H2 antagonists, you have the tidine there, cimetidine, famotidine, ranitidine, and remember cimetidine is the one that actually can inhibit the P450 and can lead to more of a drug interaction. Proton pump inhibitor, omeprazole, lansoprazole, so they have prazole. So proton pump inhibitor is the most potent in these classes of drug in inhibiting gastric acid secretion. Peptic ulcer causes, it can cause by H. pylori, which is a bacteria, and can cause by NSAID or intensive care unit stress. Mediators that stimulate acid could be acetylcholine, histamine, gastrin. Gastrin secreting tumor relatively rare, but the name is called Zollinger-Ellison syndrome. So peptic ulcer disease treatment, if it is caused by the H. pylori, you use antimicrobial agent, H2 antagonist, proton pump inhibitor, prostaglandin, antimuscarinic agent, and acid mucosal protectant. So, and in terms of the antimicrobial agent, it could be like triple therapy or quadruple type of therapy. So you have different antibiotic in the combination. Meals that worsen the ulcer, it's the gastric ulcer, and meal relieve the pain, it's more of duodenal ulcer, so that's called this differentiation. Triple therapy, as you can see, metronidazole, amoxicillin, tetracycline, or clarithromycin. Prostaglandin analog, misoprostol, it can be used in combination with mifepristone, and then it can be used for abortion. Mifepristone is an anti-progesterone type of drug, and it's also known as IU-486. Inflammatory bowel disease like Crohn's disease, ulcerative colitis. Inflammatory bowel disease treatment, you use corticosteroid or use aminosalicylate like sulfasalazine. Immunosuppressive type agent or monoclonal antibody like infliximab. So when you see MAB, it's monoclonal antibody. Immunosuppressive example cyclosporin, like in terms of restasis. Okay, methotrexate, that's a cancer drug, but it does have immunosuppression effect. Azathioprine, that's another one. Nausea, vomiting center is chemoreceptor trigger zone, area postrema. Antiemetic, you use antihistamine, anticholinergic. So example, promethazine, meclizine is often used for vertigo as well. Scopolamine is available as a patch, is an anticholinergic. Benzodiazepine, like diazepam. Cannabinoid, in terms of marijuana, would be an example. Corticosteroid, dexamethasone. Phenothiazine, like chlorpromazine. Antipsychotic, like haloperidol. So antiemetic is often used in like patient with cancer going through chemotherapy. Antidiarrheal medication, you have absorbent, like in pectin. You have anti-motility, loperamide. In this case, it's an opioid, a derivative, but work on the outside of the CNS. Anti-secretory, you have bismuth subsalicylate, which is also known as Pepto-Bismol. So in that case, it can use for anti-diarrhea. Constipation med, it's more of the laxative. You bulk forming like psyllium, stimulant like senna, stool softener like docosate. Endocrine system, treatment of diabetes tend to be type 1 is relying on insulin. So you have different form of insulin, short acting like insulin lispro, long acting it would be like insulin glargine. So type 1 insulin tend to happen early, and type 1 will run the risk of ketoacidosis, because if you don't have insulin, then the body will start to use fat to try to make sugar, and then fat will become ketones body, and you get leading to ketoacidosis. And it's usually happen in thin patient, and it's due to autoimmune system antibody attacking the beta cell of the Ehrlich-Langerhans in the pancreas. Fruity odor during the examination is maybe ketoacidosis because of acetone in the breath. So 3 ketones are beta hydroxybutyric acid, you have acetoacetic, and acetone. Common side effect of insulin is hypoglycemia. So if you have hypoglycemia, the confusion, diaphoresis, sweating, trauma, and tachycardia. Sulfonylurea mechanism. In this case, sulfonylurea consider has sulfur, so sulfur allergy should be avoided from this drug. So chlorpromide, tolbutamide, glyburide, and glipizide. Insulin secretagogue, which means that it will inhibit the potassium ion channel and then increase the secretion of insulin. Thiazolidinedione mechanism, this also known as glitazone. So glitazone, they work on the PPAR gamma receptor, intracellular receptor. It increases sensitivity of the tissue to glucose and decrease gluconeogenesis. So that's how you decrease the glucose level. But the glitazone, remember that it actually have been associated with increased cardiovascular incident in terms of heart attack, stroke, and that's why you only have pioglitazone that is being used now. Biguanide mechanism, so it increased sensitivity and decreased gluconeogenesis. So metformin is the most commonly used biguanide, the only one, and usually used for newly diagnosed diabetic patient. Meglitinide, netglinide, so they have glinide. This is also the secretagogue, but they are like short acting. So about 2 hours, whereas the glipizide and glyburide maybe 6 to 8 hours. Okay, so here are the breakdown in terms of the duration of action, and this is some of the key side effects that you want to keep in mind. Like for instance, the glitinides and sulfonylurea have a tendency of decreased glucose hypoglycemia, and the biguanide and alpha glucosidase inhibitor can lead to GI disturbance, and the glitazone can actually increase weight gain, and as I said, the glitazone or the thiazolidinedione can have cardiovascular risk. Okay, this you just pause and spend a few minutes and just review the mechanism of action and the risk. Thyroid disorder, hyperthyroidism, so symptom: heat intolerance, nervous fatigue, weight loss. In this case, are similar to too much of sympathetic kind of stimulation. Hypothyroidism, growth retardation, slow activity, weight gain, cold intolerance, constipation. Active thyroid hormone is T3. T3 is more active than T4. Hypothyroidism treatment, you use levothyroxine to supplement. Antiarrhythmic drug induce hypothyroidism. Amiodarone, because I said amiodarone have iodine in it as well. Treatment for cardiovascular effect of thyrotoxicosis, you actually use propranolol in this case just to inhibit more of the sympathetic type of response. Hyperthyroidism, you use the thioamide type of drug, methimazole and PTU. Or another way, if you can do is by thyroid ablation, but use radioactive iodine, because iodine will selectively accumulate in the thyroid gland, and that's how you destroy the thyroid gland. Adrenal steroid, principal mineral corticoid would be aldosterone. It will reserve sodium and water retention. Principal glucocorticoid would be cortisol. Glucocorticoid inhibit phospholipase A2, which this is enzyme that convert the phospholipid into arachidonic acid. And then from arachidonic acid, you have cyclooxygenase, will convert arachidonic acid to prostaglandin, to thromboxane. Glucocorticoid, cortisone would be short, prednisone would be intermediate, dexamethasone would be long, beta-methaxone would be long. Glucocorticoid side effect: acne, insomnia, edema, hypertension, osteoporosis, psychosis, hyperglycemia, and stria in the skin. Antifungal for Cushing disease, ketoconazole, even though it's an antifungal, it can inhibit the steroid hormone synthesis. Okay, let's finish this and we'll continue with part 5.